Assalamualaikum warahmatullahi wabarakatuh. My name is Daniel Hakim bin Abdul Maulud from Group F, Class 8A5, and our group will be presenting the initial ergonomics risk assessment that has been conducted at Sports Planet Warehouse Outlet located at Plaza Alam Central, Shah Alam. Sport Planet is a retail outlet that sells various types of sportswear and also accessories. Based on our observations at Sport Planet, we found out several ergonomic issues faced by the workers, which include awkward posture, repetitive motion, noise, false position, and also static posture. We will start with awkward posture. The tasks for workers at Sport Planet include organizing and arranging large quantity of stocks to be displayed. This activity causes awkward posture as it includes hunching and kneeling for long periods. So some of the ergonomic risks include straining the muscles in your neck and shoulders, leading to discomfort and neck pain. It also affects the natural curvature of the spine. Next, kneeling for a long period can lead to knee pain and stiffness. It can strain the lower back muscles, causing lower back pain. We obtained the data of ergonomic risk factors from one of Sports Planet workers. From the data, it was determined that head, leg, and knee parts were used for long periods, causing awkward posture. The total score obtained for awkward posture was 4, which is less than 6, thus advanced CRA is not required. To prevent this awkward posture issue to occur, Sport Planet can apply a few methods such as substitution, where they can use adjustable desks or workbenches that are able to be customized according to workers' needs. Next, provide workers with ergonomic chairs while doing the tasks. They could also implement engineering controls by modifying the layout of workstations to optimize reach, distances, and minimize excessive hunching. Lastly, administrative control. They could educate workers about the importance of maintaining good posture and implementing regular breaks as well as stretching exercises.
Repetitive motion is one of the things that the worker will always do when completing the job. There are many jobs that do the repetitive motion, such as pick the shoes from the floor and stack them to the shaft, put the sack in the wheelbarrow, and many more. But in this case, the workers do the repetitive motion for in long period of time. The picture shows that the workers of Sport Planet were hanging a lot of shirts using hanger. Do the same job for a long period of time can cause a fatigue of tiredness to the muscles or joint in the body. When the workers feel tired, they are easy to get sick and hard for them to do more jobs. Other than that, performing precisely the same motion or implementing certain position or grips could end up resulting in discomfort and inflammation. There are many types of inflammation. Some of the common inflammation is tendinitis and tenosynovitis. For the ergonomic risk factor for repetitive motion, there are 5 criteria that we are looking for. Based on the table, 3 physical risk factors was occur in this workplace. In total, the score obtained for repetitive motion is 3, which is more than 1. Thus, advanced error is required. To prevent this problem, there are several suggestions that can be do. First is spacing, where they can reduce the numbers of repetition per hour. Next is make a break system when they need to provide the short rest periods, at least 5 minutes per hour to release fatigue. Lastly is make a job rotation, where rotate the worker periodically to a different task involving different movements. For the engineering control, they need to design the new methods. It should be designed to reduce static, extreme and awkward posture, repetitive motion, and excessive force.
Okay, now for the noise factor. During the interview session, the workers complained that they have been listening to the same song for months. They did not have the access to change or stop the music since only the top management had the access. Thus, they complained that it is quite irritating and annoying listening to the same song. So this exposure can affect their cognitive abilities and overall well-being, which make the workers become fatigued and mentally exhausted. Other than that, it can contribute to a sense of monotony, which means a lack of variety and interest. It also can lead to decreased attention to their immediate tasks and surroundings. So based on the assessment provided in the guideline, the workers were only exposed to annoying noise during working hours. The noise level is considered acceptable, therefore no exposure above the permissible exposure limit, which is known as PL. So the only way to prevent this problem is, of course, just replace the music with another playlist that is more suiting to the worker. Other than that, their shift scheduling can be considered as preventive action, which is classified under administrative control, because each worker is given 2 breaks and a rotating shift between the floor, cashier and the store. So at least the workers got some break time from noise exposure.
And next we move on to phosphorylation. As you can see from the picture shown, is a worker who is lifting a heavy stock of shoes and store items straight from the ground and carry it around the floor. This ergonomic risk can put excessive strain to the muscle, joints and ligaments, leading to musculoskeletal injuries such as sprains, strains or hernias. Repeated heavy lifting without sufficient rest can also lead to fatigue, reducing an employee's ability to perform effectively and safely. Next is also lifting without a proper support or assistance can all contribute to back injuries. Next, we move on to the summary of single manual handling activity for the phosphorylation. As you can see from the table on the right, all the activities does not exceed limit except for one, which is carrying. Carrying does exceed limit because of the store has a very large area and workers have to carry their stock from one end to another, which exceeds the 10-meter mark which we can see from the left table, which then need to be conduct an advanced error form. Next is for the prevention. For the prevention, the first one is substitutional, is to provide mechanical aids to reduce the amount of force required for the task. Example including using cart or rollage for heavy lifting. Next, we move on to administrative control. The first one is to provide training, which to educate workers the importance of using a proper technique when lifting. This can be used by using the larger muscle in leg and core, while also maintaining neutral spine and avoiding bending or twisting. Second is team lifting. Encourage teamwork to distribute the workload, sharing the force exertion required by reducing the strain altogether.
Moving on to the next section, static posture. While working at the cashier counter, workers are not permitted to sit on a chair, forcing them to stand and maintain the same body posture for a lengthy amount of time with no movement. This behavior poses an ergonomic danger to employees by causing muscular and joint strain as a result of standing too long. It can also impair blood circulation, producing muscular weariness and numbness, and it can even lead to thrombosis if it is severe enough. We then obtain the ergonomic risk factor from one of the Sport Planet worker. Based from the result obtained, the worker doesn't work in a static position, so the total score achieved for the static work posture is 0, and advanced error is not required. Preventative measures may be taken to mitigate the effects of a static work position. First, by substitute to an ergonomic mouse and keyboard to give better comfort when using it and lessen strain on the body during static work. Then, utilizing engineering methods by using anti-fatigue mats in standing workstations to provide cushioning and support to decrease pressure on the legs and lower back. Finally, administrative controls to be accomplished by informing the worker about the significance of optimal working posture in preventing injury and strain. Another method is to take regular pauses and practice stretching exercise to reduce the risk of injuries.
Next, we move on to the initial error form. The initial error form is needed in order to know if the risk factors needed to be conduct an advanced error or not. As we can see, there are 3 risk factors that needed to be conduct an advanced error, which is phosphorylation, repetitive motion, and lastly is noise.
Based on the error form previously, repetitive motion, force exertion and also noise issues are exceeding the requirements for advanced error. Therefore, it should be conducted at the workplace. It consists of 5 steps, starting off by reviewing the initial error, which identify the control measures implemented, whether it is adequate or not. After that, gather the additional information of the worker and then assess the ergonomics risk factors. So based on the error guideline, the force exertion issue should use the manual handling assessment chart, which is known as the MEC tool. For repetitive motion, a trained person is recommended to use OKRA checklist, which is a tool to determine the risk of developing musculoskeletal disorders, which is known as MSD. And for the noise issue, a sound level meter, which is known as SLM, should be used to assess the noise level at the workplace. Next, the result must be summarized in table form with all the details stated on the slide. And lastly, all the suggested improvements must be classified according to the workplace condition based on the financial, time, manpower and expertise to implement the action. So that's all from us. Thank you for listening.